Our guest today is the Executive Director of the Illinois Medical District. The Illinois Medical District Commission, their mission is to provide service by assembling the nation's premier concentration of healthcare facilities and providers. The Illinois Medical District consists of 560 acres, houses 2,200 hospital beds, has 29,000 employees, and receives 75,000 visitors daily. Prior to serving in this position, our guest today served as Director of the Department of Commerce and Economic Opportunity for the state of Illinois. And our guest today grew up in Olney, Illinois. Ladies and gentlemen, Warren Ribley. Warren? All right. Have fun up here.
Good afternoon, everyone. Jay, thank you so much for that kind introduction. Truly a humbling experience to be before the City Club of Chicago to tell you about the new story of the Illinois Medical District. Very pleased to be joined by our commissioners, the governing body of the Illinois Medical District. Jennifer Woodard, our president. Jennifer. Meredith O'Connor. Jim Clulo. Blake Searcy. Sandy Goldman. Dan Trevino. Thank you for your commitment. Thank you for your vision. Thank you for your leadership. And thank you for your support. I think it's noteworthy that these are non-salaried positions, which make their efforts all that much more extraordinary. Commissioners, thank you for your service. The staff of the Illinois Medical District, I want you to raise your hands. Come on, raise their hands. Thank you. Thanks for being here. We have a motto among our staff. They know what I'm going to say. It's achieve the unachievable. It's a goal to which we aspire every single day. Thank you for your hard work. Imagine, if you can, 29,000 jobs from bio startups and scientists, doctors, nurses, administrators. 50,000 patients seeking access to medical care every single day. Affordable, world-class health care, easily accessed by public transportation, including the imminent bus rapid transit on Ashland Avenue. Breakthroughs in research that will ultimately change the face of healthcare from ending diabetes at a cellular level to making AIDS and cancer chronic diseases rather than death sentences. 55 acres of land ready to develop just minutes west of the Loop. Then you can imagine the potential of the Illinois Medical District. Unfortunately, though, for way too long, that potential has gone unrealized. Its resources untapped in any coordinated fashion. But 18 months ago, that story changed. The prelude to our story began a year earlier when Governor Quinn traveled with a group of Illinois business leaders to the Bio International Convention in Washington, D.C. I remember the day vividly. We're sitting in a room with the business leaders, 30, 40 of them, Denisenko, you were there. Maybeth, you were there. Jim, I think you were there. We're talking about issues of the day. And the governor asked, "What's going on in the Illinois Medical District?" The response was stunning silence. No one knew. Back in Chicago, further exploration led to more questions. Still seeking an answer to the governor's question, well then, I was director of the Illinois Department of Commerce and Economic Opportunity, the state's economic development agency, and I didn't know the answer to the question. But the more I learned, my interest became piqued by the potential for economic growth. But little did I know at that time exactly what was achievable in those 560 acres. The district was founded in 1941 by an act of the legislature, 72 years ago, and its mission was quite visionary then and incredibly relevant today. To increase medical education at the highest professional levels, to enhance research and technology, and to build, grow, nurture, commercialize new high technology enterprises. We're governed by a 7-member board of commissioners, 4 appointed by the governor, 2 by the mayor, and 1 by the Cook County Board President. We are a self-sustaining unit of local government that controls development and zoning throughout the district. The district is home to some 80 health, education, public safety, social service, and technology entities, ranging from the Red Cross of Greater Chicago, the Ruth Rothstein Core Center, the Easter Seals School of Autism, the regional FBI headquarters, Great Point Energy, Stat Analysis, Dr. Kumar's with us today, and the Chicago Technology Park, one of the country's oldest and largest biotech incubators, currently hosting 32 emerging businesses. 2 medical universities with 10 professional degree programs, ranging from medicine and nursing to pharmacy and dentistry, all anchored by 4 major medical centers: Rush University Medical Center, the University of Illinois Hospital and Health Science System, the John H. Stroger Jr. Hospital of Cook County, and the Jesse Brown VA Medical Center. Some of those partners are with us here today: Dr. Ram Raju, Tony Rajkumar, and John Morales from Cook County, Dr. Brian Becker from the University of Illinois, Dr. Julio Silva from Rush, and Kevin Hall from the VA. We welcome your partnership. Yet, for all that was happening within the district, Rush's new medical center, the new Cook County Hospital, major expansion at the Jesse Brown VA, nothing was happening for the district. The district had ceased to represent its great institutions as a single entity, failing to realize the collective sum as much more impactful than its individual units. Far too many were even unaware of the district, let alone the incredible resources, researchers, and healthcare that exists there. But I heard Governor Quinn's vision for the economic potential. I heard the governor's idea for how it should serve our community at home through patient care and more broadly through world-class research. And I recognize the opportunity for the district to lead the region's expansion in the biosciences. So, 18 months ago, I accepted Governor Quinn's appointment as Executive Director as ratified by the new Board of Commissioners. Today, supported by a new commission and a re-energized professional staff, we are working on a new story for the Illinois Medical District. I'm very pleased to be here today to tell you about our achievements. The new commission's first priorities were to restore our financial integrity, re-engage with our core partners, and develop a strategic plan with specific steps to make our vision a reality. We retained the expertise and insight of the Boston Consulting Group. They brought their A-team, Michelle Russell, Dan Grossman, with us today. They benchmarked the district against 6 other health science and innovation clusters around the U.S. They conducted more than 50 in-depth interviews with leaders from the district's hospitals, universities, clinics, businesses, our commissioners, elected officials, all designed to provide candid feedback. They were aided by a private sector advisory council that we created, consisting of proven leaders and entrepreneurs in the life sciences, led by Jim Tyree. Jim's with us today. Jim, thank you for your ongoing support. Also to Jeff Aronin for your contributions. The council added a no-nonsense, practical business perspective. That collective input has had significant impact on our story. Today, we are focused on 4 priorities: community health, translational research, clinical data, and infrastructure development. These are the principles that guide our day-to-day operations. Bring us an idea. Bring us a project. Bring us an opportunity. And these are the lenses through which they will be filtered. Our focus on community health will establish us as a national model for improving preventative care and chronic disease management. Translational research will validate our role as a national leader for patient-oriented discovery. Aggregating and analyzing clinical data using innovative technology will result in better health outcomes for patients. Our infrastructure development will transform our commuter institutions to a community that supports its students, employees, and patients. What else did we learn? We have the most diverse patient population in the United States, both from an ethnic and socioeconomic background. More than 500 principal investigators are supported by more than $220 million in research funding. More than 700 clinical trials include participation of the district's hospitals, researchers, and patients. With 8,000 medical students and 560 acres, we are the largest urban medical district in the U.S. Now let me add just a little personal perspective to that. I grew up in downstate, Jay indicated, Olney, Illinois. Some of you may have heard of it. Home of the white squirrels. Population, about 8,000. I grew up on a farm. My dad farmed somewhere between 500 and 600 acres. Pretty good sized farm then. But I know an acre isn't a real common unit of measurement here in the city of Chicago. So, imagine 560 and 8 football fields stacked side by side in a square, and it gives you a sense of the size of the Illinois Medical District. We know from a just completed economic impact study that 29,200 people work in the medical district, earning $2.2 billion in payroll and paying nearly $100 million in taxes. The district adds $3.4 billion to the economy of the Chicago region. And in addition to improving the medical health of our local community, we are positively impacting its economic health. 20% of the employees live in just 8 surrounding communities. I want to thank the Illinois Science and Technology Coalition and the UIC College of Urban Planning and Public Affairs for leading the study. Our focus on community health is simply designed to help area residents gain access to healthcare services. Our support of Cook County and the County Care Initiative has aided their success in expanding Medicaid to more than 93,000 Cook County residents. In 10 months, they are well on their way of enrolling 115,000 residents in the early implementation of the Affordable Care Act. Got to commend Dr. Raju and his team for continuing to lead. I would challenge you to name a hospital that has been more of a leader throughout its history in healthcare reform and innovation than Cook County. Dr. Raju and the team are following in the pioneer footsteps of Ruth Rothstein, who is a longtime leader of Cook County Hospital. Many of you know Ruth recently passed. God rest her soul. Those of you that know her well know she had little time for rest while she was with us here on this earth. Rest in peace, Ruth. There's a construction of the Mile Square Health Clinic on Roosevelt Road, which will provide access for 18,000 patients for the outpatient and preventative care they need and deserve. Mark Donovan at UIC's led the execution of that effort. Thanks a lot, Mark. We aided in the development of the district's Hospital Emergency Preparedness Coalition, whose efforts are designed to minimize loss of life and reduce collateral damage in the event of a disaster, a key initiative of our strategic vision. We will be the center for emergency response and disaster preparedness training. We are partnering with the new Crane Medical Preparatory High School, Malcolm X College, Governor Quinn's Health Science Learning Exchange, all designed to help prepare students and young adults for jobs in a wide variety of health fields. Our translational research efforts will bridge research from biomedical discovery to patient care and the commercialization of that research. But we can still improve the capacity and collaboration among our district partners and our regional health system partners, and we must. Currently, only 20% of research collaborations occur between district partners. That's why we're working hard to bring Quintiles, the world's largest contract research organization, to the district to aid in the management and administration of clinical trials. That's why we're partnering with Takeda Development Center Americas, one of Illinois' global pharma leaders, and iBio to figure out how industry can better interact with our researchers, clinicians, and patients. Recognize Dr. Azmi Nobolsi and his team from Takeda, including Marilyn Vetter. Thank you for your partnership. That's why we're reaching out to the region's other academic healthcare systems to collaborate together. We believe these efforts have the potential to increase biopharmaceutical research and clinical trial capacity by 30%, which equates to millions of lives positively impacted. Facilitating the sharing of clinical data will improve patient care outcomes and cost efficiency. We're working towards the installation of a high-speed fiber optic network that will facilitate exchange of critical data among our district's hospitals, universities, and businesses by making internet services up to 100 times faster than currently exists. This allows doctors and clinicians to download and review files and images, which can mean the seconds that count in life and death situations. Our baseline analysis and roadmap forward is nearly complete, assisted by the efforts of Fujitsu Network Communications. Our focus on infrastructure development has already resulted in wins for and among our district partners. We've broken ground on a $2.9 million expansion of our Enterprise Center 1 laboratory building, which will complete Great Point Energy's relocation of its North American headquarters from Cambridge, Massachusetts to Chicago in the Illinois Medical District. I think we'll all agree we need more stories like that to tell. Brenda Bush-Maline's here from VOA, the architects on that project. Fred Berglund Construction, the general contractor. Thank you for your efforts. The Anatomical Gift Association is relocating to the Illinois Medical District. In the coming weeks, we will begin the transformation of the former Standard Oil building built in the early 1900s. It will be the cornerstone of development in the southwest portion of the district. We are aided by a $900,000 grant awarded by the Illinois Clean Energy Community Foundation, one of their largest awards ever. Mike Inns did a great job with Tactical Designs in putting that application together. This 5-story building will become a near-zero energy use facility and be the first of its kind for energy efficiency and sustainability in Chicago. But more importantly, bringing the AGA back to the district supports our regional hospitals and universities and provides ample new space for anatomical and life science training. Paul Duty, Bill O'Connor are with us here today. Neither of these projects, however, would have been possible without the generous support of Governor Pat Quinn, who provided much needed construction dollars from the Illinois Job Now bond program. Thank you, Governor Quinn. Also thanks to Andrew Moyer, John Casey, and Therese McMahon from DCO. Initial work has begun on the $13 million vertiport, which will enhance critical emergency medical services throughout the city. The vertiport will consist of a 15,000 square foot terminal, a 4.5-acre tarmac with hangars to accommodate 60 helicopters. The 10-acre site is owned by the district, but will be privately financed and developed by Nighthawk Services. Mike Conklin, Anthony Armacido are with us today. Thank you. We are in negotiations with a national coffee chain to set up shop in the district. The facility will offer indoor seating for coffee enthusiasts and allow for a casual environment to catch up with friends, review study notes, or just to take a break. We all know that no story is complete without the aroma of fresh coffee brewing in the neighborhood. And just 2 days ago, the commission selected a developer for a mixed-use development at the intersections of Harrison, Damon, and Ogden Avenues, the 2020 West Ogden project. The development will be led by Higgins Development Partners. Jack Higgins, John Higgins, Tom Samuels are with us today. This project will be a game changer for the district, bringing necessities that don't currently exist, and once and forever establishing a community with access to lodging, conference space, retail establishments, restaurants, young professional housing, life science laboratory buildings, medical office space, all situated around a central plaza that will serve as a gathering place for students, patients, patient families, employees, and yes, entrepreneurs. This $163 million development will become the gateway of the district and the central hub of the health and biosciences sectors throughout the entire region. Supported by the current alignment of governmental leadership, an improving economy, and a high-growth healthcare sector, the district is positioned for excellence in healthcare research and innovation for decades to come, forever realizing the mission for which we were created. This new chapter of the Illinois Medical District story is about being a leader in patient care and medical research, utilizing our diversity and unique assets in driving economic growth. Within the next 10 years, the district will generate at least 4,500 new permanent jobs and spur business development, leading to an additional $300 million in revenue. But our story isn't over. There are opportunities for many people, all of you, to be a part of it. From the healthcare industry to the investment community, government leaders to patient advocates, developers to doctors, we'll continue to partner with those who share our vision to become a recognized leader in healthcare and biotechnology, becoming a district against which others will be benchmarked. Ladies and gentlemen, that is our story, and we are sticking to it. We are confident that we are the region's next bestseller. And I look forward, Jay, to coming back to the City Club in the future to share additional chapters of our success. In the meantime, thank you to each and every one of you for coming today. Thank you for your continued support, and have a great day.
If you have questions, going around, who's besides Sarah? Tina? No, not Tina. A lot of, by the way, how many of you have been to Only? Raise your hand. You think we're all a bunch of city slickers. Huh? How many remember Congressman Bruce?
Yep.
How many remember his brother?
Yep.
Well, suffered in you, of course. So you just watch out with that. Yeah. Playing that downstate card here. Okay, here we go. Well, since you mentioned it, Darcy Evans from UIC. What are the plans for the old Cook County Hospital building? Roger, you could have a follow-up if you like.
It's actually a very good and a very timely question. The commission at our meeting on Tuesday just approved the framework of an intergovernmental agreement with Cook County government for the redesign of the entire Cook County hospital complex. I'm not going to say too much about that because I don't want to take away from Dr. Ramraju or President Preckwinkle. But I can say this as a preview. I think that redevelopment, not only of the old hospital facade, but that entire campus is only about maybe a quarter or two behind us. That's why we felt very important to partner together. Thank you.
How many of you ever worked at the old Cook County Hospital? Raise your hand. Suffered than I. That's where you learn to sit with your legs up because you never knew what was running around. All right, Steve Schlickman, where in the heck are you? All right, only because I like your dad. Urban Transportation Center, UIC. Other than the Ashland, here we go again, BRT proposal. Thank you. That's the BRT, not the BLT. What is the district's need for better transportation service?
It's actually a very good question. The needs are immense. One of the things that we're very pleased to be coming in cooperation with the city is the redesign of the Blue Line IMD stop to make it handicap accessible. You know, I take buses to work myself. And as I go down Harrison Avenue and we stop at Ogden Avenue, the bus empties. Patients going seeking care at Cook County Hospital. When I take the Roosevelt Street bus, we stop at Taylor and Damon. The bus empties out with veterans seeking care. We've got to do a much better job of providing public access. One of the things that we hope to see coming with the development at 2020 West Ogden is an enhanced shuttle service that will help carry employees and patients, visitors around the district. Very good question.
Pretty good answer, too. All right. Carlos Ponce. A lot of acronyms, but I'll still do it. Does the IMD have a MBEWE participation requirement for its construction projects? This is the City Club. We let sandbagging allowed. If yes, Carlos, you're a hell of a guy. How much has been spent?
I'll be honest with you, I don't know the answer to that second question, but the answer to the first question is yes, we certainly do have a policy to support minority business enterprise. It's part of every single procurement that we have. It's part of our procurement policy that's publicly available on our website. We recognize that we have a commitment to the entire community around which surrounds us. That's the west side, that's Pilsen, to the north and near west side. We'll be working closely with all community members to make sure, remember that statistic I cited though, 20% of the employees that live or that work in the district live in 8 communities immediately surrounding. Good question, we recognize the need, we're cognizant, and we will be very fair in that regard.
How about a round of applause? We got parting gifts.